if the patient has a history of any trauma, and now patient have the history of you can say locked jaw, and other than that the patient has a history of respiratory failure, we will say that this is a patient of the Clostridium tetani. And if examiner asks you a question that a patient present to you with taking a lot of antibiotics from a long period of the time, the specific one is the clindamycin, and now the patient have the diarrhea, which of following pathogen is causative agent of the diarrhea, will say it is a Clostridium difficile. Current jelly-like sputum can be seen in which type of the patient, we will say this is a Klebsiella. If most commonly atypical pneumonia is occurred due to which of following pathogen, we will say it is a mycoplasmic. If bodies are elevated in this type of the patient with the IgM antibodies. A patient who is working in a refrigerated company or just took a shower into the hot water, and now the patient has a history of the high-grade fever, cough, and other than that the patient has some brain involvement, which of following pathogen, we will say it is a Legionella. Now I have a question for all of you guys. It's your turn to give the answer in the comment box. If examiner asks you a question that which of following pathogen is the most common agent which cause the UTI. Number one, second most common pathogen which cause the UTI in the sexually active couple. Number three, which of following pathogen which cause the UTI and also the stone formation. Number four, the patient has a complaint of the bloody diarrhea with GBS, Guillain-Barré syndrome, which of following pathogen can lead to these type of the symptoms. The patient has a hemolytic uremic syndrome, which of following pathogen. If a patient has a history of just rice intake, and now patient have the after rice intake the patient have the watery diarrhea, which of following pathogen is causing these type of the watery diarrhea. Other than that, one more question for all of you guys, that if a patient has a history of rubella infection, which of following neonatal cardiac anomalies can be seen in the baby of the patient. Inshallah, we'll see you next video. Fi amanullah, Allah Hafiz, take care.